Hello everyone. Today we will talk about viral gastroenteritis as part of microbiology of the gastrointestinal system. So we'll start with a general overview of gastroenteritis, which means inflammation of the stomach, gastro, and the intestine. Enter and the itis suffix refers to the inflammation that takes place. So gastroenteritis is an inflammation of the gastrointestinal tract, especially the stomach and the small intestines. Gastroenteritis can have infectious and non-infectious causes. While the more common are the infectious causes, we also have some non-infectious causes, like the use of drugs, like NSAIDs, for example, certain foods. So in people who have celiac disease, they cannot tolerate gluten. For example, when they eat gluten, they will have inflammation in their intestine, which is referred to as gastroenteritis. But the topic of this lecture is about infectious causes, and more specifically, viruses. Although gastroenteritis can be caused by bacteria, fungi, or parasites, but viruses remain the most common cause of gastroenteritis. Although there is regional and seasonal variation in the etiological agent, but viruses are probably the most important agent in causing gastroenteritis. So we can see here some of the more famous pathogens that cause gastroenteritis. Campylobacter is thought to be the most common bacteria to cause gastroenteritis, followed by E. coli. While in the case of viruses, we have Norwalk viruses and rotaviruses, which we will come to in detail during this lecture. Gastroenteritis is characterized by two major symptoms, vomiting and diarrhea, although we can have some more symptoms, and we will discuss that when we come to the clinical manifestations of gastroenteritis. So previously, it was thought that bacteria is the cause of gastroenteritis, like Campylobacter and E. coli. And anything other than bacteria was referred to as non-bacterial gastroenteritis because they couldn't find the causative agent of this gastroenteritis. They used to call it non-bacterial gastroenteritis. But in the 70s, with a group of articles that showed that there is nanometer-sized particles that are associated with acute infectious gastroenteritis, and they used to call it non-bacterial gastroenteritis. Now, although viruses have been described since the early 1900s, it wasn't until 1970 that they were found to be a causative or an important causative agent of gastroenteritis, and that's probably due to their smaller size, maybe harder culture techniques, and so on. But since then, we have realized that viruses are an important cause of gastroenteritis. And here is one of the first articles to describe that viruses cause this disease, where they visualize using electron microscopy those nanometer particles associated with gastroenteritis, because they have an outbreak of gastroenteritis in Norwalk, Ohio. They refer to those viruses as Norwalk viruses and Norwalk gastroenteritis. But later on, they found that those viruses, which are part of the Kalisi viruses, but with a C, not with a K, were found to cause epidemics in other places of the world. So now they call them more commonly as noroviruses rather than noroviruses. But it's not only those noroviruses as part of the caliciviruses that are causing those gastroenteritis. We have a group of viruses that we can see here, but two of the most important of them are the rotaviruses and the noroviruses, which we have just mentioned. And as you can see, most of them are RNA viruses, except for adenovirus, which is a double-stranded DNA virus. And we can see here some electron microscopy images of those more common causative agents of gastroenteritis. And in today's lecture, we will talk about rotaviruses and noroviruses in detail. So if we look at the epidemiology in general of viral gastroenteritis, we'll see that it affects people of all ages worldwide. And if we look here at this pyramid, we can see that there is around 20 million cases yearly. Okay. And out of those, some will go to the doctor. So 1 out of 2 will go to the doctor in an outpatient. So it's not that it's serious, at least the patient thinks so. And then 1 out of 9 of those individuals, or 400,000, will go to the emergency department, and 1 out of 50 will need to be admitted to the hospital, and around 1 in 5,000 will die. And most of those cases that end up with death usually take place in the elderly people who have already some debilitating health conditions, and also among children, especially in developing countries where rehydration therapy is not accessible as it is in the developed world. So children and elderly people are where those fatalities from gastroenteritis usually come from. While for healthy young adults, acute gastroenteritis is rarely fatal and can be managed with rehydration. We look more specifically at our first causative agent, norovirus. We can see that it causes about 20 million cases each year, and it's the leading cause of outbreaks from contaminated food out of all pathogens. I suppose out of bacteria and all viruses, norovirus is the leading cause of disease outbreaks. And most of them will come from infected food workers. Okay. Now, as you can see, because due to the large number of infections that happen each year, most adults worldwide have antibodies to these viruses. So after you get the infection, you start to develop antibodies against those noroviruses. As for the transmission of noroviruses, they usually take place through the fecal-oral route. But it's also present in the vomitus. So when a person vomits, you can have a group of viruses found in the vomit, and anyone who gets in contact with this vomit will also can also get gastroenteritis. So it's not only the fecal-oral route. And this is important because very few viruses can be infectious. Okay, so if we look here, there are a few graphs here that are taken from the CDC website. So you can see that as few as 18 viral particles of noroviruses, which is quite a small number for something that is nanometer in size, right? So those that are found on the head of a pin can infect more than 1,000 people. Okay, so it is very contagious, this virus, and that's why it causes such major outbreaks. And most of this contamination happens in restaurants. So the outbreaks will take place in restaurants. And we'll have an interesting case report during this lecture where we will look at that. Also, there's schools and daycare, healthcare facilities, hospitals, for example, and sometimes in private residence. Catering or banquet facilities, similar to restaurants, they give the majority of outbreaks. Okay, so a highly contagious virus spread through the fecal oral route, but also found in the vomit. To the point that transmission can happen by aerosolization, which means when the virus particles are spread into the air, if someone gets in contact with them and inhales them, then swallows them, he can get gastroenteritis. Contaminated fomites, so for example, if you touch the clothing of someone or the chair where someone is vomited, or you can get the disease can be transmitted. And also there is person-to-person contact, like shaking hands with someone did not properly wash their hands, for example. Okay. Now, how does norovirus cause the disease? They think that for the in the first step of viral infections, usually we have certain receptors found on the cell, right, where the virus will attach, be internalized, and cause its cytopathic effects. And this is what takes place with noroviruses. Indeed, they think that there is a group of carbohydrates found on the gastroduodenal epithelium, so in the upper GI tract, that serve as ligands for the attachment of noroviruses. And those carbohydrates are similar to the carbohydrates that make up the blood groups. So it seems that some people are more susceptible to norovirus infections than others due to the presence of those carbohydrates on their epithelium. So the virus starts by attaching to the epithelium and then gets internalized and causes the cytopathic effects. And what sort of cytopathic effects does norovirus cause? It will cause broadening and blunting of the villi. So those villi, as we can see here, here's normal villi, they become shorter, they become more blunted, not as pointy as here. And also the microvilli, those small microvilli will become shortened. And the crypts, which work in GI secretions, the crypts here, the crypts, will have crypt hyperplasia, which means there will be also more secretions. So there will be more secretions. The villi will be destroyed, blunted, and shortened. So there will be less absorption, and that will manifest in the form of diarrhea, right? And also the lamina propria underneath here will be infiltrated by immune cells that come to the site following infection of the virus. So it's a general inflammatory state in the gastrointestinal tract. Like a similar picture to this can happen, for example, when a person with celiac disease ingests gluten. There will be an inflammatory state in the GI tract that is quite similar to what we see in gastroenteritis: blunting, shortening of villi, shortening of microvilli, crypt hyperplasia, and so on. While the colon is usually spared, and the histopathological changes in the stomach also have not been noted frequently. Okay. So this pathogenesis that we see, this histopathological changes, will show in clinical manifestations in the form of vomiting and diarrhea mostly, but we will also have abdominal cramps and nausea. And this illness lasts for around 12 to 60 hours. So it has a short duration. And it's characterized by a sudden onset that follows an incubation period of 24 hours. So maybe within 24 hours of eating the contaminated food at the restaurant, the person will go and start vomiting. That's one of the more prominent features. And they will also have some abdominal cramps, and maybe they will have diarrhea. Then you would think gastroenteritis, right? And then afterwards, as we will see in the diagnosis, you try and decide, is this bacterial or viral? Okay, so vomiting is more prevalent among children. It's a more prominent sign, more prominent symptom of the disease. While in the case of adults, they mostly have diarrhea. But in general, viral gastroenteritis, vomiting is more prominent. Now, you can also have constitutional symptoms or generalized symptoms such as fever, chills, headache, and some pain muscles or myalgias. And if the patient is describing the stools for you, they will be loose and watery, and it very rarely contains blood, as happens with some bacterial gastroenteritis. Okay, bacterial infections, you'll probably have blood. But here it is loose, mute, and watery without a mucus and without blood. So how do you diagnose viral gastroenteritis? Now, first of all, it is probably a diagnosis of exclusion, which means you culture for the bacteria you think there is, and you don't find anything. It's a non-bacterial gastroenteritis. Then, if you want to go further and actually see what subtype of norovirus there is, or what sort of virus it is, you can do several tests. One of them is PCR, or polymerase chain reaction, where you look for the RNA of noroviruses. So how do you do that? You take the stool of the patient, you recover the virus, and you extract the RNA of the virus. You make complementary DNA from this RNA that you extracted, and then you amplify it by PCR. If the virus is there, then you will start seeing those curves indicating that viral RNA was there and it generated complementary DNA and it was amplified to give those curves there. And afterwards, you can take this complementary DNA and sequence it to know what subtype of norovirus you're dealing with. And those are probably done either for research purposes or when there is an outbreak of the disease and you want to document which norovirus has caused it. But in general, as I said, it's a diagnosis of exclusion. And in case that you actually needed to diagnose the patient, as we said, in many cases, it just people either go outpatient clinics or they stay at home and they resolve the disease. Okay, so we can look either for the nucleic acid, you can look for the RNA with PCR, or we can look for some antigens on the virus particles using enzyme immunoassays. So we use antibodies against specific antigens on the virus and we can see if the virus is found in the stool or not. But currently, there is no single assay that detects all human caliciviruses because they have genetic diversity. So maybe uh, the primers you use will not be amplified because there is because of the genetic diversity of the caliciviruses, and using enzyme immunoassays, maybe you will not find the antigen you're looking for because of the great antigenic diversity. Okay. Now, for research purposes, as we saw in the first paper in the 70s, they use also electron microscopy. So you can use electron microscopy also, but that is mostly for research purposes and not diagnostic purposes. Okay, so if you think this person has viral gastroenteritis, what should you do? What is the treatment? Well, as many other diarrheal diseases that you have learned about, the disease is mostly self-limited. And the most important cornerstone therapy, just rehydration. Okay, oral rehydration. You need to hydrate the patient, as we see in the graph here. And if the patient keeps vomiting, for example, if it's a child and they keep vomiting, then oral rehydration might not be enough. And if you fear severe dehydration, then you should give IV fluids. Okay? So you try to rehydrate the patient. If they can keep the water that you're giving them, it's fine. If they cannot, they keep vomiting, then you should give IV fluids. And of course, there's no specific antiviral therapy that is available at the moment. So we can see here in this graph also from the NHS, say there's no specific cure for stomach bugs. So they call it that. Sometimes they call it the stomach flu, I think. بالعربي اسمه التهاب معوي. Right? So you need to stay hydrated, stay at home, so you do not transmit the thing to other people. If the kid is at school, then they should stay at home for at least 2 days after the symptoms have disappeared. Then you try to prevent spread by using good hygiene, and we will see later on. If there is pains, like myalgia, as we said, there's some constitutional symptoms or fever, or you can give paracetamol for those constitutional symptoms. Right? Now, the important part in gastroenteritis is preventing it from the start. You should work on prevention to prevent epidemics. Okay? And most of it takes place while preparing food. So, as we said, most of the transmission happens where? In restaurants. Right? And most of it will take place during preparing food. So what you can do is you clean the vegetables, you cook the food thoroughly, especially shellfish. You cook it thoroughly. If you are sick, you stay at home. You avoid touching food with bare hands, of course, and essentially you wash your hands, right? And you try to keep all the surfaces that you're working with clean and sanitary. Now let's look at a case, an interesting case of viral gastroenteritis. So they talk here about an outbreak of gastroenteritis following a meal in a large hotel, during which one of the diners, so one of the people who was having dinner there at the hotel, vomited. Now, the clinical features suggested noroviruses. And this was confirmed by electron microscopy and reverse transcriptase PCR of stool samples. So this tells us what methods they can use to confirm the presence of noroviruses: RT-PCR, and electron microscopy, probably for the because of the outbreak. Now, when they looked at the nucleotide sequence of the PCR amplicons that they have amplified, they found that there is identical strains in all of those people who were dining at the place. So what would you think? You would think that the food is contaminated because everyone is getting the same gastroenteritis, but they go and look at the food, okay, and they could not find the cause of the outbreak in the food. So what they do is that they start to analyze how this happened, and interestingly, they draw a pattern where the person who vomited is on. So this is the restaurant with 6 tables, and you'd see that the person vomited here, and around the tables closest to the person who vomited, okay, table 1 and table 3 here, they had the highest attack rates. Why? Because they're closest to the person who vomited. So the person vomited, the virus was aerosolized around the restaurant, and people got infected. And the closer they were to this people, to this person who vomited, there was a higher chance that they will get gastroenteritis. So that shows how infectious is norovirus, right? We said only the tip of a pin, or 18 viral particles, the tip of a pin can infect 1,000 people. Now 18 viral particles are enough to infect one person, okay? And that's why it is often associated with outbreaks. Now let's move on to the second important virus we were going to talk about, and those are the rotaviruses. Rotaviruses, similarly to noroviruses, cause gastroenteritis, and everything is quite, there's more similarities than differences. Let's put it this way. There's more similarities than differences between gastroenteritis caused by norovirus and rotaviruses. But especially rotaviruses are important in children under 5 years of age. We said noroviruses affects people of all ages, and it is the most common cause, but rotaviruses are an important cause in children. And you can see that worldwide, nearly all children are infected by rotavirus by 3 to 5 years of age. Okay, so all across the globe, okay, in developing and developed countries, even with the differences in sanitization, everyone gets rotavirus. And we'll see the implications of that later on. But yes, rotavirus, they did not find a change in incidence between developing and developed world. And worldwide, nearly everyone is infected by it by the age of 3 to 5 years. Now, neonatal infections within the first 3 months of life are often asymptomatic or mild. They think that's because the neonates have antibodies that come from the mother's milk, or they were given transplacentally during pregnancy from the mother, or afterwards through breast milk, and those antibodies are providing some protection against the virus, so that the infection that the virus causes is asymptomatic, has very few symptoms, and is usually very mild. But later on, after 3 months of life, of age, when those antibodies given by the mother start to disappear, then those infections will likely to be symptomatic. They will cause symptoms of diarrhea, vomiting, and so on. And the incidence peaks at around 4 months to 2 years, okay, before the immunity develops properly. And now, because of the suboptimal access to hydration therapy, as we said, in developing countries, we do not have proper hydration therapy. So, for example, in sub-Saharan Africa and some places in Asia, sadly, some children will die because they were not provided with a proper hydration therapy. And if you look at this graph here, the red gives 100 to 500 deaths per 100,000 cases of rotavirus infection. Actually, here it's per 100,000 children under 5 years of age, but we said that almost virtually all children will be infected with rotavirus. So anyway, all around the world, the incidence should be similar of rotavirus. Everyone is infected with rotavirus. But you can see in those areas, in sub-Saharan Africa, and some areas in Asia, there is a much higher mortality rate, from less than 10 deaths to 100 to 500 deaths. And that is, as we said, due to poor access to hydration therapy. Now, also regarding the epidemiology of rotaviruses, they found that in temperate settings, if we look here at the world, those areas in the world are called tropical areas. And then those areas like the US, Canada, and most of Europe, and some parts of Australia, they are referred to as temperate settings. And in those temperate settings, we have seasonal variation, where the outbreaks happen during cooler and winter months. So rotavirus season is in the fall and winter in those temperate regions. While in tropical settings, there is not much seasonal variation. The disease occurs year-round. Now, there was a vaccine developed against rotavirus infections, and this vaccine has been very helpful in decreasing rotavirus detections in symptomatic cases in a national network in the US, a national network of laboratories. And we'll come more regarding the vaccination issue with rotaviruses. So, if we look at this graph, we'll see that in certain periods of the year, those are different years. Each different colored line is a different year. So we'll see that, first of all, that there is variation during the time of the year, right? So during winter months and maybe until early spring, we have a high incidence of rotavirus infections. But this graph also tells us something else, that after the introduction of the vaccine in 2006, right, we can see a significant decline, yearly decline in rotavirus cases. Okay. So regarding the pathogenesis of rotavirus, it is also quite similar to noroviruses. So you can see that the rotavirus will go to the lumen of the gut, and will infect the epithelial cells here, especially in the jejunum. Okay, so it is in the proximal small intestine. It will infect those villi and will destroy those villi, will cause its cytopathic changes. So some of those enterocytes or epithelial cells lining here, they will start to shed off and die. And those villi will become blunted and shorter. The microvilli on the edge of the cells will also shorten. The crypts here uh, that is a place where secretions in the GI tract are made. They will have some hyperplasia, so we will have or proliferation of those crypt cells, and this will result in secretory diarrhea. So a decrease in an absorption and an increase in secretion. So, of course, the pathogenesis we talked about will show clinically, and it will show in the form, first of all, vomiting that frequently precedes diarrhea. So you start with some vomiting and afterwards diarrhea, and the incubation period might be a bit longer than what we see with noroviruses. Yes. And the symptoms will probably last a little bit longer than what we see with noroviruses. So here it will last up to 1 week. That's why maybe in places where there is poor access to rehydration therapy, after 7 days the baby can get dehydrated, and this will lead to death. As for the diagnosis of rotaviruses, it is similar to noroviruses, where you will look for the nucleic acid, you look for the RNA using PCR, or you look for some antigens using enzyme immune assays. And this is one of them. It's an ELISA for rotaviruses in the feces. So it will probably include adding the stool samples after they have been processed. You add them in those microwells, and then you add the antibodies against the antigens on rotavirus, and then you detect in places where you find a signal, then it is probably a case of rotavirus. And in places where you do not get a signal, then it's probably not caused by rotavirus, because you could not detect the antigen of the virus. Okay, you don't have to go into details into this, but you should know that detection takes place using PCR mostly, or through enzyme immune assays. How do you treat? You should know by now, it is oral rehydration therapy. If the child cannot take it, IV replacement therapy. Okay? Antibiotics and antimotility, which means they decrease the motility of the gut and inhibits diarrhea. Those agents are a big no. They should be avoided. You do not give antibiotics, do not give antimotility agents for diarrhea, especially after knowing that it is a viral gastroenteritis. Now, we talked a bit about the presence of a vaccine that was introduced in the US in 2006, right? And what prompted looking for this vaccine? Because they found that there is a similar rate of rotavirus infections, rotavirus gastroenteritis in developed and industrialized nations, so that the hygiene improvements and sanitation improvements were not likely to reduce the disease incidence. So they looked for another method to reduce the disease incidence, which kills a number of children. And how did they do that? They came up with a vaccine. Actually, they came up with two new vaccines through large studies in several regions in the world. They finally came up with two safe rotavirus vaccines, and those vaccines helped in a decline of more than 70 to 80%, quite a significant decline in rotavirus hospitalization and emergency department visits. And now in Jordan, in 2015, I found this headline that says rotavirus vaccination drive begins next week, which means now in Jordan, we also have rotavirus vaccination as part of the general vaccination that a baby should get. Now, at the end of the lecture, I thought it's a bit appropriate to compare viral gastroenteritis, which we learned about today, to bacterial gastroenteritis, which you already have learned about in previous lecture in microbiology of the GI, in the GI tract. Now, as for viral gastroenteritis, especially with rotaviruses, the incidence in developing and developed countries are quite similar. Okay. But in the case of bacterial gastroenteritis, it is more common in poor hygiene and poor sanitation regions of the world. Now, sanitation, of course, will help in both, okay? As we saw in norovirus, how are we going to prevent it? By using proper hygiene methods. But maybe the simplest of methods can get rid of bacteria, but not all of them can get rid of viruses. And that's why we still have similar incidence in developing and developed countries, while we have a much higher incidence of bacterial gastroenteritis in developing countries. And now the infectious dose, we said that it is quite low. For example, noroviruses, we have only 18 viral particles can cause infections, which means it is quite an infectious agent. While in the case of bacterial gastroenteritis, it depends on the bacteria. In certain cases, you need a high inoculum to cause disease. For example, more than 100,000 E. coli in order to get the disease. While in the case of Shigella, you only need 10 bacterium to cause the disease. As for seasonality, in the case of rotavirus especially, in temperate climates, we have winter seasonality, while for bacterial gastroenteritis, it is more common in summer and rainy months. Maybe the temperature is suitable for the growth of bacteria on certain foods and so on. The incubation period, it differs. It can be from 1 to 3 days. Here it can also be 1 to 7 days. But in the case of 1 day or even hours, if you remember, we said that there is probably a preformed toxin, like with Staphylococcus aureus toxins or Bacillus cereus. If there is a toxin already preformed, then we start seeing the symptoms within a few hours. And the reservoir here can be human, Shigella and some types of Salmonella have only human hosts, while other types of bacteria can have also animal hosts. While for those viruses, it is primarily humans. Of the differences here between viral and bacterial gastroenteritis. In the case of fever, we said that constitutional symptoms are common with viral gastroenteritis. while in bacterial gastroenteritis, it needs to be an inflammatory diarrhea, a more severe case of diarrhea, like with Salmonella and Shigella. While traveler's diarrhea from E. coli, for example, you will most probably not find fever. Vomiting, we said in viral gastroenteritis, vomiting is the prominent and can be the only presenting feature, especially in children. While in adults, we said there is also diarrhea. So while in the case of bacterial gastroenteritis, preformed toxins, okay, if they're present, then we will have vomiting, but otherwise, it is most probably diarrhea that we are going to face with bacterial gastroenteritis. And here it is non-bloody, this diarrhea and common, while it is occasionally bloody with some agents, for example, with Shigella, with Campylobacter jejuni, those can cause bloody diarrhea. The duration, now it varies. In noroviruses, we said 1 to 3 days, up to 60 hours, the symptoms can resolve, while for rotaviruses, it can take up to a week. And this timeline is actually similar for bacteria. As for the diagnosis of viral gastroenteritis, we said the diagnosis, it's a diagnosis of exclusion. So what do we exclude? We exclude bacterial gastroenteritis, and if we don't find bacterial gastroenteritis, then it is most probably viral gastroenteritis. And if we want to be sure, or if there is research going on, we can use enzyme immune assays to detect rotavirus and adenovirus. Those are the viruses for which commercial kits are available. While for bacteria, what do we do? We culture stool samples, and we can use some more molecular techniques to look for bacterial antigens and so on. Now, as for the treatment, it is also similar. Diarrheal diseases, supportive therapy to maintain adequate hydration. So hydration is essential, and if not given orally, then IV, antibiotics and antimotility contraindicated. Same here, hydration should be enough. Now, sometimes if you suspect dysentery, you see there is, for example, high fever, there's bloody stools, there's significant cramps or pain, then you can give antibiotics, especially after you know the pathogenic agent. Okay, then you can give antibiotics in some cases of bacterial gastroenteritis, but never, of course, with viral gastroenteritis. Okay, with this, we have finished our lecture, and you can go back and read some more, and I will give some links in the description of the video.